Okay, we are looking at the scapula for this video. I will try to follow along in the order that you have it in your coloring book, what I've posted onto Engage. So if you're following along, go ahead and use that list. So I've got a scapula here. Again, one of the first things you'll want to do, doesn't have to be first, but one of the main things you'll need to do with the scapula is tell me if we are looking at a right or a left. So for every bone that we'll see in the body, my rule is that there are two things you'll have to note on the bone to be able to tell whether it's a left or right. And that's true for the scapula as well. So the main thing is this spine of the scapula. That's going to be along the posterior aspect of the scapula. Maybe easy to remember if you think of your spine as your back. So the spine of the scapula is on the posterior side. So that's the first thing we'll use to determine whether this is left or right. The next thing will be this glenoid cavity or glenoid fossa. This is where, or this is the portion of the scapula that makes the joint with our humerus to form the shoulder. So this we know has to go on the lateral aspect because our humerus obviously is able to move laterally to both abduct the shoulder, to perform flexion, extension, all of that. So this is going to have to be lateral. So best perspective might be this way. We're looking at the anterior side of the scapula here because the spine is back there. This is the lateral aspect. So we have a right scapula here. You could pick other two features or two other features to determine this, but some of those will be a little harder to use. So I'll give you my two for every bone, but whatever you like to use to remember right and left is good with me. So going down our list now, obviously we already identified the spine of the scapula here. That's going to be on that posterior aspect. We've also got two fossa to see on this posterior side of the scapula. Fossa just meaning some kind of divot, a depression in the bone. And so we'll see these as some kind of a cavity. So the first one we'll see is above the spine or superior to the spine of the scapula. This is our supraspinous fossa. Supra just meaning superior, of course, relative to the spine. So supraspinous fossa. The larger portion here that we see on this posterior side is our infraspinous fossa. Those are the two fossa you'll see on the posterior side. Supraspinous, you also see mostly from the superior side. So those two fossa. If we flip around to the anterior side of our scapula, now we are looking at the subscapular fossa. Subscapular fossa because it is sitting against the ribs. This is what we'd see of the scapula if we're looking at the back, if it's dissected out. Subscapular fossa would be pressed up against the rib cage. All right, going laterally, we already talked about the glenoid cavity or fossa. You can give me either one, that's fine. And again, this makes the shoulder joint with the humerus. Next, we've got two processes that kind of stick out here on either side of that glenoid cavity or fossa. The bigger one that will be on the posterior side, more posterior, superior, this is our acromion process. Easy way to determine this is that it is an extension of the spine of the scapula. So if you find the spine and keep following it, you are at the acromion process. This is the point that articulates with the clavicle. So if you palpate that on yourself and follow your clavicle more laterally, so you kind of hit that bony prominence, you are touching your acromion process. More anteriorly, the other process here is our coracoid process. This you can almost see as an extension of our glenoid cavity or fossa. It's just adjacent to that, our coracoid process. And again, that will be more on the anterior side. Finally, just looking at the scapula as a whole, we have three angles to determine here. Two of them are pretty easy. Inferior angle is just this border on the inferior side. Superior angle is up here, of course, on our superior side. Lateral angle, a little harder to pinpoint one distinct spot because this is our lateral side of the scapula here. But the entire lateral edge here is our lateral angle of the scapula. And that's it for scapula. Again, we have a right one here, be sitting like this in the body. That's the scapula.